So what I want to talk about today is just try to hit on kind of what every family and caregiver and person living with dementia needs to know. If you have any questions, raise your hand, just stop me, I'm happy to answer them. And I'd like this to be interactive as much as possible. I'm absolutely fine with that. In fact, I encourage that. All right, well. Oh, where's Brian? I think you might have locked it. No, and he came over and did something. All right.
You can maybe ask, if they have a specific question or problems that they want to find out. Answer that.
Does anybody have anything?
I do.
Sure.
What is the difference between dementia and Alzheimer's?
Okay. So we're gonna go over that. Dementia is like an umbrella term, and then there's specifics underneath it. So you've got Alzheimer's dementia, which is the most common and the one that most people have heard of. There's vascular, there's Lewy Body, there's frontotemporal lobe dementia, there's mixed dementia. There's actually over 120 different types of dementias. Okay, and I feel very passionate about the fact that finding out does make a difference what type your loved one has. For sure, but we'll go over that a little bit more. I'll get into the different types. Yes, ma'am.
Were you talking to me?
Yeah.
I would like to know what kind of tests are given to know exactly what type of dementia the person that you're caregiving has. How do you know? Are there tests for that?
Yep, we're gonna go over that too. For certain tests, so there's blood testing, specifically for Lewy Body. There's skin punch tests that they can do. There's SPECT imaging that Dr. Amen does with Amen clinics that they can tell, because there's certain areas of your brain where the activity will be low based on what areas are affected. That helps with the diagnosis. So it's always a matter of clinical assessment, seeing the person, getting the history, and then doing the test. There's also spinal taps, which is not the most comfortable test, but there are tests that can be done. There's actually a blood test now that if you're over the age of 55, you can have done that will give you a percentage of the chance of you getting dementia at a 97% accuracy rate.
Does Medicare pay for that, or is that out of pocket?
That is out of pocket.
Ooh.
But they have grants, so I have some clients that have been able to get it done for as little as $200, which they felt, it's like a $2,000 test if you're paying for it. But they have money that they help. Yes?
Speaking from just a little bit of experience, my mother passed away in 2004 and she had Alzheimer's. And I have a brother that is in his 80s and now he's been diagnosed with dementia. So at what point does that actually, and I don't know if this is even answerable, but at what point can you actually determine whether it's one versus the other?
At any point in the journey, really, when you start noticing the changes. Normally what happens is we don't get a diagnosis until something's been going on or something devastating happens and you're like, whoa. But then when you think back, it's like, well, wait a minute, he's been doing this, or this has been going on for years now. So, but as soon as somebody, lost their keys, you want to be setting up for dementia testing.
Well, I did get tested a year ago just because of what I just shared. And fortunately, everything was fine, at least it is right
What kind
now.
of testing did you get?
Yeah. What's that?
What kind of testing?
I went in where they had me do all these memory things and I had to write stuff down, remember, and they, rattled off all kinds of words. recite what I heard 10 minutes ago. I went through that.
So there is one that your primary care will usually do, and that's called a SLUMS test. And that's like, draw a clock. Here's 3 words, I'm gonna ask you some more questions, and I'm gonna come back to that. That also is determined by your education level, so a lot of factors go into that. That's a very preliminary test, just kind of, at the surface. If something comes out of that, then usually your doctor's gonna recommend you go to a neurologist, who will then usually recommend neuropsychological testing, which is about a 4 to 6 hour test. I have deep brain stimulation, I have movement disorder, so I had to go through that testing before I had brain surgery to make sure that my brain could handle the surgery. I'm telling you, this was 8 years ago, so I was 49 at the time. It was absolutely exhausting. I told my husband, I said, I don't think I'm gonna be able to do it, I'm stupid, I didn't know anything. The answers, and thankfully I passed. But then to imagine somebody with dementia having to go through that. And I've been with a couple of my patients that have gone through that, and most of them can't get through the entire testing.
How would that determine, I'm sorry.
So
how would they determine if you're uneducated or not the smartest apple on the tree, if you will? Or is it dementia, or is it old age? How do they determine that?
So as far as with the SLUMS test, they're gonna ask what's your highest level of schooling. So again, that part is very basic. But with the neuropsychological testing, different parts of our brains keep different sorts of information. So based on the questions that you answer correctly or incorrectly, that can help determine which part of your brain is firing correctly or not. And for instance, with Alzheimer's dementia, it's usually the parietal lobes and the temporal lobes that are most affected. Frontotemporal lobe dementia, it's going to be the frontal lobe that's affected. So that's one of the many different tests that they can do. All right. So the many phases of dementia. So as I mentioned, there's Alzheimer's, vascular, frontotemporal lobe, Lewy Body. Plus, and I'm also going to add some actors and actresses in here just to kind of, that had it, just to help you with, know kind of who has it. So SPECT imaging, as I talked about, skin punch biopsies, there's new lab testing, and then why it matters. The 4 pillars of prevention: nutrition, physical exercise, socialization, and sleep are key factors. Planning while you can, so getting your power of attorney, your living wills, making all those decisions and having those conversations with your family or whoever you're going to appoint to make these decisions for you sooner than later. And you don't, like my power of attorney outside my husband is not my family, because I didn't feel comfortable and confident that my family could uphold my wishes. So I have some good friends that are going to be that person. So it doesn't have to be your family, but you need to nominate somebody, okay? And then caring for the caregiver, all right? Staying connected, again, finding your village, taking care of yourself. 40% of caregivers die before the person they're taking care of because they isolate themselves. They don't go to their doctor's appointments. They don't eat right. They're not sleeping. You have to take care of yourself before you can, like they say, you have to put on your oxygen mask before you can help somebody else. All right? So whether you're living with a diagnosis, caring for someone who is, or hoping to protect your own brain, this is the conversation for you. All right. So dementia is not one disease, all right? As I said, it's an umbrella term for a decline in memory, thinking, reasoning, severe enough to affect activities of daily living. All right, how many of us has misplaced our keys, or you put something down, but you retract, you remember where it was. It's not like you're not remembering how to brush your teeth, or how to take a shower, or how to pay your bills. Things like that is more severe, and that should be setting off red flags. There's over 7 million Americans currently age 65 or older that are living with Alzheimer's dementia today, and that's, gonna keep climbing, unfortunately. There's also over 100 different diseases that can contribute to dementia. 1 in 3 seniors dies with Alzheimer's or another type of dementia, and 2 out of 3 caregivers are females. And statistics say that if you're a man being cared for by a woman, your lifespan is gonna be longer than if you are a woman being cared for by a man. So, I'm grooming my husband now. All right, so I just kind of am focusing on the 5 most common types, all right? So we've got Alzheimer's disease, which is 60 to 80% of dementia. Vascular dementia, which is caused by reduced blood flow to the brain. Vascular dementia often happens to people after a stroke or people that have had chronic high blood pressure. So think of issues that affect their vasculature, that affect that blood flow getting to their brain and that oxygen getting to their brain. I also find in vascular dementia, sometimes they have really good days or minutes or moments, and then the next can be really off, and that has to do with the fluctuation of the blood flow. There's mixed dementia, which is very, very common. Frontotemporal lobe, so that's gonna be Bruce Willis, Wendy Williams. So there's 2 types of that. There's one that affects the speech, like is what Bruce Willis has. So he first started, they had to start telling him words in a little microphone in his ear because he wasn't remembering his lines until they finally diagnosed him. And then there's a behavioral variant, which are a lot of the clients that I wind up helping because it affects the frontal temporal lobe, which is where we make our decisions. That's what gives us the ability to see things from somebody else's point of view. They get very impulsive. They almost seem apathetic. They just kind of like the lights are on, but no one, like they don't care about anything. They don't care about anyone. And it's not true, but it's because of the damage to the frontal lobe of the brain. The frontal lobe is the last part of your brain to form, so that's why insurance rates don't go down until you're 25, because it takes until you're actually 26 to 28 before your brain is fully developed. And insurance companies knew this a long time ago. But it's the first part of your brain that can start to deteriorate. And then Lewy Body dementia, which is often misdiagnosed as Parkinson's. And they are very similar, but if someone starts having movement issues first, it's more likely Parkinson's over Lewy Body. But if they start having more of the memory issues and hallucinations and sleep disturbances, then it's more likely Lewy Body. But there's a lot of clients that I have that have Parkinson's and Lewy Bodies. And there's also Parkinson's dementia.
Jesus.
Yeah. I'm going to see one today at 1:30 actually. So Alzheimer's disease. As we talked about, that's the most common one that has to do with the tau and amyloid plaques that build up in the brain. So difficulty recalling recent conversations or events. Trouble finding the right words, which is called aphasia. That can also happen after a stroke or a brain injury. So there's a lot of different reasons that things can happen, so we don't want to always jump to dementia right away. You need to make sure that your vitamin B levels are good, your vitamin D levels are good, that your thyroid, you want to have everything else checked first before you're going to go to a diagnosis of dementia, because is it something that can be reversed? Because sometimes it is. Maybe somebody just underwent surgery and had hours of anesthesia, and I've seen people get discharged from rehab with a dementia diagnosis. You don't just get dementia overnight or in a couple of weeks. It's something that happens over time. But because they may become delusional after surgery, sometimes they get slapped with this diagnosis that they have no business being stuck with now. So poor judgment with money or decisions, maybe their bills aren't being paid, maybe you go to visit them and notice there's, pink slips, yellow slips, maybe the water's turned off, maybe you're getting calls that they paid their mortgage twice. I've heard all sorts of things. All right, so those are some of the red flags. Some of the faces you'll know, Ronald Reagan, right? Rita Hayworth and Glenn Campbell. Vascular dementia. Again, caused by the reduced blood flow to the brain, often after a stroke, or from long-term damage of the small blood vessels. So chronic hypertension, high cholesterol, things like that. So slow thinking, difficulty organizing their thoughts. If you ask them something, they just can't get it. You can tell that they're struggling. Trouble planning or following steps. People with all sorts of dementias, all types, eventually have problems with sequencing. That's why sometimes showering becomes so difficult, because they don't understand what to do now that they're in the water. I've had clients that were earlier on, one with Lewy Body in particular. So she knew that she had trouble, showering. So we wrote out all the steps, laminated it, and put it in her shower. But there were 22 steps to taking a shower. There's 12 for brushing your teeth. We don't think about that, we just do it. But when you lose that sequencing ability, it just becomes overwhelming and you don't know what to do, so you do nothing because it becomes too much. Symptoms can worsen after a stroke or a trans-ischemic attack, a mini stroke, they call that a lot of times. Often occurs alongside heart or vessel disease. So Roger Craig, I don't know who this is, Alistair Stewart, a British news anchor. Mixed dementia. A lot of dementias are this, but it's more than one type of dementia. It's often Alzheimer's and vascular dementia. There'll be a combination. And this is more common in people over the age of 80. I've had clients with Alzheimer's dementia as young as 38 of early onset. Okay, so it can be across the gamut. One of my clients just passed away 3 months ago, and she was 62. She'd been living with it since she was 40. So imagine that on the family and the kids, and but her mom had early onset as well. So symptoms can be combined memory loss, vascular type changes, often underdiagnosed because it presents differently in every single person. And I always say, if you've seen one person with dementia, you've met one person with dementia. Because every person is unique, every situation is unique, how they present is unique. So these are just kind of guidelines, but it's not hard and fast. More common with advancing age and may respond to a combination of treatment approaches. This one, mixed, is usually confirmed only through imaging or autopsy, so it's rarely headline diagnosis. I didn't have any. Frontotemporal lobe. Again, this affects the frontal and the temporal lobes, which are right above your ears. Okay. So this is the brain center for personality, behavior, language, speech, the Broca center. It often strikes earlier than dementia, sometimes in people's in their 50s or 60s. And the trajectory of someone with FTD is, like 6 to 8 years, where Alzheimer's you could live 20, 30 years with it. So that's why it matters too, knowing what type, so you can try to prepare for the future as much as you can without having a crystal ball. So noticeable changes in personality or social behavior. I had a woman with this, she was only in her 30s. She had just started dating this guy. This was in San Diego. She had just started dating this gentleman. They were grocery shopping, and she started taking her clothes off in the middle of the grocery store. And he had no idea what was going on or what, she wound up being diagnosed. I actually worked for hospice at the time, and she was one of my clients. This guy just started dating her. He stayed with her. She only lived like 2 years after that. He stayed with her that entire time. I don't know what that was all about, but he's a saint in my book. And they have no, I'd come to see her and she'd get like right up in your face. just no awareness of social cues or anything. So noticeable changes in personality or social behavior, such as undressing in public. Loss of empathy or increasingly impulsive choices, just boom. They like to wander too, they just wanna go when they wanna go. Difficulty speaking, naming objects, or understanding language that you're saying. A lot of times, families will want to get hearing tested on people, right? And absolutely you should have hearing tested, but oftentimes it's not a hearing issue, it's a processing issue. So it's not that they're not hearing what you're saying, they're not understanding what you're saying. So a hearing aid, making it louder, or me speaking louder, isn't going to change that, it's a processing issue. Yes, ma'am?
Can the key signs from one type of dementia cross over to another type of dementia?
Sometimes.
Oh my God.
Sometimes, but frontotemporal is, well, at least for me, it's much easier to be able to tell what's going on. But somebody with Alzheimer's is a little harder sometimes because it's slower. Like this is pretty abrupt, and when it happens, you're not gonna miss it. And they're younger too. This is in your 50s and 60s. I placed an engineer about 4 years ago that had frontotemporal lobe. He died 3 years after placing him, but he was 58 when we placed him. I mean, these people are young.
I heard that there is not a gene thing,
Not necessarily.
right? It is-
Not necessarily.
So if your brother has it, or your sibling or whatever, it doesn't necessarily mean that it runs in the family.
Nope. And just because even if you have a gene, doesn't mean that gene's gonna be turned on, okay? So that's why exercise, nutrition, socialization, sleep, those are the things you can do to help prevent it for yourself. Memory is often relatively preserved early on, so memory isn't often an issue with them. It's just this impulse control and this, it's hard to miss. So Bruce Willis and Wendy Williams are two famous people that FTD. Lewy Body dementia. So this is caused by abnormal deposits of a protein called the Lewy bodies in the brain, and it blends cognitive decline with movement symptoms and vivid sleep disturbances. My clients that have Lewy body and Parkinson's, I've got 3 of them, very acting out, punching, kicking, yelling in their sleep. And oftentimes this happens long before the symptom, they're actually diagnosed. So fluctuating attention and alertness day to day. My one client, he would go almost like, not comatose, but he would be out. He would not talk, his eyes would be open, he was not alert. I can't tell you how many times his assisted living sent him to the hospital. They would do all these tests, they'd never find anything, but this is Lewy. It's what Lewy is. It can be very scary until you know it, until you recognize it, but they can't figure it out. It's just kind of lights go out. Visual hallucinations, often detailed and vivid. We had lots of, we did dialysis on the beach in Mexico. We had lots of things that we did when he would hallucinate, but you just go with it, right? You don't fight him with it, you just go with it. Movement symptoms similar to Parkinson's, so they get that slow, shuffled gait, but then all of a sudden they'll take off. So with him, it was the Parkinson's first, and the Lewy body came later. Acting out the dreams during sleep. Robin Williams, that's what he wound up. He committed suicide, and once they did the autopsy, the practitioner that did his autopsy said he'd never seen as many Lewy body deposits in somebody's brain as he saw in his.
Wow.
And the poor guy never knew he had it. Just thought he was going crazy, that's why he killed himself. And then Estelle Getty from the Golden Girls. This can be a younger diagnosis too. So why knowing your type changes everything? So prognosis, different types progress differently. Knowing which one you're facing helps you and your family set realistic expectations. Treatment, some medications help one, like Lewy Body you have to be very careful with the medications you give people with Lewy Body. A lot of the medications you'd give somebody with Alzheimer's or even frontotemporal will have a negative effect on somebody with Lewy Body. So having a doctor that understands your dementia too is, not every neurologist is a dementia expert. And then if you're talking about FTD or Lewy Body, that's even more specific. And then planning. An accurate diagnosis, right, is what makes legal, financial, and care planning possible while the person can still be part of their decisions. Just because somebody has a dementia diagnosis does not mean they can't make decisions. You need to find a time of the day that works best for them. You need to, and early on, they can still make decisions. You want them to be part of those decisions. That's why having conversations with your family early on is so important, or whoever you're going to choose to be that designee for you. So bottom line, a diagnosis isn't a life sentence, it's a map, all right? And that map is gonna be clearer and help you better navigate. So SPECT imaging. I just was certified through Dr. Amen, just took an 8-month course with him, and SPECT imaging is absolutely fascinating. It shows blood flow and activity patterns across the brain. It's not just to diagnose dementia, but it's ADD and ADHD. There are 7 different types. Whoever knew? So the type that you have, the treatment matters. So with SPECT imaging, they could look and they could see, all right, your parietal lobes are really low, or your temporal lobes are really low. That, and then the clinical assessment that you're doing can say, that you have Alzheimer's, or maybe your frontal lobe is off. Then you've got frontotemporal lobe. So SPECT imaging can be very helpful. It also isn't covered by insurance, unfortunately. Dr. Amen has, I think, 12 or 15 clinics across the country. And, there's different, I think it's anywhere from $3,000 to $5,000 for that testing. But it's a thorough testing, and you can leave there and they'll send you with a plan. So a nutrition plan, an exercise plan. You can't reverse it, but you can help to stall it sometimes if you do what's right and what your brain needs.
Kimberly, with that, so is that something, can they foresee, like if I went 60 and they can say, well, it's not dementia yet or Alzheimer's yet or whatever, but there are signs of it, so that if you, so can they tell that from that?
Yeah. And sometimes they'll do 2, that they'll do one image while you're just kind of resting, and then they'll do another image while you're trying to do something. And then a lot of times when people are trying to engage their brain is when it slows down. So there's different types, and then the intake as well. So different types of dementia create distinct patterns of reduced blood flow. And this is one of the only tests that shows that. So for example, the temporal parietal region versus the frontal lobes. Functional imaging like this can add another layer of information alongside the cognitive testing and the clinical history.
I have a question on that. Is there in the professional world, is there a push for people to actually get this insured through insurance? Because to me, that's our biggest obstacle ever, is just what's covered under insurance. Because if it's not, my mom is never going to pay $3,000 to $5,000 for something like this. There's no way.
Yeah, there is. Dr. Amen and all the doctors that work with him and us that are certified, but we're absolutely trying to push for this. Because how much money would that save on the back end if we knew right off the bat, this is what they have?
Instead of all the trial and error with all the drugs,
Exactly.
all the treatments, it just...
Right, all the other things that we give people because we give them the wrong treatment.
And is this imaging available if you pay for it quite easily, or is that only through the doctor?
Dr. Amen, so his clinic specifically, they're specializing in that. There are some hospitals that have the ability to take, the problem with SPECT imaging is that they may get the results, but they may not know how to read them. So he's also on a mission to get more doctors involved to understand, different clinicians like myself, to be able to read these SPECT imaging, to, okay, you've got this test result, now what? The skin punch biopsy test. This is a good one for Lewy body. So it's, they take it from the neck or the arm, I think. Small, minimal invasive skin, often from the neck or the leg, can be tested for the nuclei, this folded protein behind Lewy body dementia and Parkinson's. So it's a pretty benign test that can give you a pretty definitive answer. Recent studies show this test can identify Lewy body-related disease with strong accuracy, offering an option beyond spinal fluid testing, which previously required a lumbar puncture. So some of the blood tests, there are some blood tests that can be done for Alzheimer's as well. But again, your thyroid, your B12, your metabolic panel, you want to do all of these to rule out anything else first. Also genetic testing, the ApoE4, to understand your personal risk. If you have, if you test positive for one of the genetic testing, I think you're like 40% risk. But if you have two, it's like a 70% risk of getting it. But again, you don't have to get it. Doesn't mean 100% you're gonna get it. And then the cerebral spinal fluid testing when more certainty is needed. So these are just some of the tools used by thousands of neurologists, and it is covered, the skin biopsy is covered by Medicare, yet it's not yet FDA approved.
So Kimberly, she had asked about being hereditary. So you said, but that was the one specific one you said wasn't, but other types can be hereditary, right? I mean,
Alzheimer's can be hereditary,
yeah,
right?
okay.
And you could have the gene, but again, the gene doesn't have to get turned on. Okay.
Because like my mother-in-law, 5 out of the 6 siblings all got it in their 70s, early 70s. So, yeah.
And the older we get, your risk increases as well. And now that we're living longer. All right, so the 4 pillars of brain health. None of these is guaranteed, that it's gonna prevent, but research consistently links nutrition, physical exercise, socialization, and sleep. So do your best to get, I know that people say, oh, the older you get, the less sleep you need. BS, that's not true. Maybe the less sleep you're getting, but that doesn't mean that you don't need it. And remember, my goal, and I hardly ever hit it because I have trouble sleeping, is try to get 7 hours. Well, that means I'm gonna have to be in bed for 8 to 9 hours to truly get that 7 hours. So you need to think about that too. Nutrition, so the MIND diet, so a blend of the Mediterranean and the DASH eating diet. And the DASH eating diet is the one that's good for your heart. So think about it, it's good for your heart, it's good for your brain. All right, so leafy greens, berries, nuts, olive oils, fish, whole grains, limiting the sugars, the processed foods, which all of us, that's all we have. Staying hydrated, drinking, half your body weight in water every day. And then watching your alcohol intake. They're finding more and more that alcohol is not our friend. Aim for 150 minutes a week of brisk walking, swimming, or cycling, some sort of moderate aerobic activity. And I always tell my patients, I don't care what you do, just do something. And as long as it's something you like, you're gonna do it. So I could try to give you this elaborate plan, but if you're like, I ain't doing that, well then what's the point? So if you like taking your dog for a walk, do that. Just do something, keep your body moving. Strength training, 2 sessions a week supports balance, independence, and metabolic health. So again, any movement counts. Gardening, dancing, household chores, they all contribute. Again, consistency matters more than the intensity. and finding something that you like. So protect against falls, balanced focused movement, Tai Chi reduces fall risk, which is a major risk for decline. Socialization, prioritizing regular contact, weekly calls, visits, shared meals with friends and family, more than we assume, that's really helps. Join a group with purpose, a faith community, clubs, volunteer work, combined to give you a sense of contribution. Keep learning together. So it's not just doing the same Sudoku puzzles or the same crossword, it's new learning is what our brain needs to keep it active. And watch for withdrawal. Pulling away from others can be an early sign worth a conversation with a doctor. A lot of the seniors that I work with that were talking about placement, nobody wants to leave their house. But if they're not getting the socialization, that is a huge part of longevity. And if they want to be around for a while, sometimes that could be the very reason why going to a community makes sense for their health, for the socialization. So sleep, try to get 7 to 9 hours a night. And remember, if you want 7 to 9 hours, you're gonna have to be in bed longer. Watch for, sleep changes. So acting out dreams can be an early sign of Lewy Body. Mention it to a doctor. Sleep apnea, huge contributor to dementia. So if your partner tells you you're snoring, you should get a sleep apnea test. I know those machines aren't great, but they can help keep your brain healthy. And build a wind down time. So stopping the screens, not eating 3 hours before you're gonna go to bed, stopping the screens 2 hours before I have a very strict morning routine, but I also have a wind down routine. So I've got like red light bulbs in the house. When it starts to get dark, we put those on just to get your circadian rhythm, get your body used to, okay, it's time to wind down. So capacity is a ticking clock. So legal documents, again, early on in their process, they can make some of these decisions, but if you wait too long, you might be needing to try to get guardianship or conservatorship, which costs a lot more money. And they can fight it and very difficult and drawn out. So your medical power of attorney, living will, financial power of attorney, and HIPAA authorization. Medical aid in dying, I want to touch on this because I'm a death doula. I also volunteer for the end of life options. And unfortunately in the United States, because of how the laws are, there's about 12 states currently that have medical aid in dying laws, but the challenge with dementia is you have to have full decision-making capacity and a terminal prognosis in order to qualify. And with dementia, early on, you're gonna have that capacity, but you're not gonna be terminal at that point. So it really kind of is ruled out for people with dementia in this country. People still go to Switzerland and other places with dementia because they can utilize their rights there. So from a caregiver perspective, you cannot pour from an empty cup. So except when someone's offering to help you. That neighbor that keeps asking, what can I do? And you're saying, nothing. Let them help. Let them go pick up a prescription. Let them pick up your grocery order. Accept the help. Take the help. It's not a weakness. It's not a weakness at all. Schedule respite time on the calendar. Mark time off when you can go take care of yourself. Get your hair done. Go visit with a friend. There's caregivers out there that would be happily fill those couples of hours. I know that it's money, but you know what? It's your health is worth more than you're going to be paying out. And then keeping your own medical appointments. Caregiver health often gets deprioritized first. I'll just worry about myself later, and then later never comes. All right, and again, 40% of caregivers die before the person they're taking care of, if you're taking care of dementia. Any other situation, it's 30%. That's still a huge number. And then join a caregiver support group. Isolation compounds burnout. The Alzheimer's.org, they've got a lot of different groups on there. Some are in person, some are online, Facebook has things. So reach out, find your village, and then stay connected. So someone with dementia, meet them in their reality. Correcting or arguing rarely helps. They're just trying to connect. And behaviors are really, they call them behaviors, which really irks me. It's their way of trying to communicate. So what is this behavior trying to tell me? Why are they doing this, or why are they saying that? It's not just to be ornery, even though that's how it seems sometimes. There's something behind that. So kind of putting on your Sherlock Holmes hat sometimes and trying to figure out what's really going on. Someone that keeps saying, I want to go home, I want to go home. You are home. It's not a physical home, it's that sense, that feeling that you get when they're home. They're missing something. Something is not right for them. So trying to investigate and figure out what that is. If they're waiting at the front door for their dad to come home and he's been dead for 50 years, that's all right, wait with them. You know, what do you miss about dad? What are you looking forward to when dad comes home? You know, join them. They're just trying to connect. Use short, simple sentences and give time for a response. Let them answer. Oftentimes we're always in a hurry, so we're just trying to throw words at them, trying to figure out what they want, and then they're losing the words that they have. So give them time. Lena, music. Music is great. Old photos, familiar routines to open up conversations. Focus on feelings behind the words. Even when the words don't make sense, usually you can take a word or two going, okay, I think this is what they're talking about, and try to, just kind of unravel that. And then celebrate the small moments of connection, because they still count. All right, you don't have to navigate this alone. So whether you're diagnosed with it or someone that you're caring for, the earlier you can start planning, the better your outcome. Yes?
Okay, thank you. 2 questions. Do signs help? Like, I leave my mom notes. I don't know if I'm making it worse or not. And then sometimes she'll ask me a question and I'm like, think. Should I just give her the answer?
So if she asked you, like give me an example of what question she might ask.
So when is Judah's birthday?
Okay,
And so usually I'll say, when was your dad's birthday? And then she'll get it. But then sometimes I'm like, is it easier to just say it's the 19th?
That kind of depends. I mean, if she's looking for the answer, most people want to be as independent as they can be, and it's more helpful for,
But I'm kind of forcing her to
right.
think longer,
Right.
or I'll give her clues. So
I think that's okay, as long as you get to the point and she's not getting frustrated with it.
Okay.
I think that's okay. Getting curious and just, that also starts a conversation in a way to connect.
Okay.
But just saying, think about it or something like that, that's probably not the best.
And then notes.
No, notes are good. Pictures, so Montessori, like they use for kids, they are adapting to folks with dementia. So pictures are very helpful. Like I bought some fake money that looks and feels and smells just like real money. It came from, it's what Hollywood uses. Because I have a few clients that are so obsessed with money, they always want to have money on them. So I give them a couple of 20s, they put it in their wallet, they're happy as a clam. They don't need money in their assisted living. They don't, of course we let everybody know, hey, this is fake money, so, don't let them
Go spend it.
But that just takes, that anxiety's gone, because now they've got that money in their wallet that they've always had. So you want to try to think outside the box. How can I help fulfill this for them? With dignity and all of those things. Anyone else?
Yes, I have, we already, both my mom and my father-in-law, because my father-in-law's really struggling now. We already have power of attorney medically, we have all of that stuff. My concern is he has a tendency to get in his head, he's gonna take things like that away. how do you prevent that? Because he clearly would only do that because he's in the wrong state of mind. He would never take that ability of my husband to help him away in his right mind.
Well, I mean, is he going to go to an attorney's office and get an attorney to actually do something
He
like that?
might go online,
I think,
get
you know,
scammed.
well,
That's
I mean,
our concern,
yeah.
yeah.
yeah. And some of that is.
Tear up the paperwork, yeah, we have copies of it, but that's he gets frustrated, understandably.
Yeah.
Have they been actually diagnosed?
Ooh. I don't know that he's actually been diagnosed, because he's at the point now where we have healthcare coming into the house instead of him going to all the things.
So
there's not an
physicians
official-
coming.
Yeah.
Yeah. I mean, I think, you know, you just gotta keep an eye on it, but as long as you guys have copies, I would document stuff.
Yeah.
Keep a journal.
Okay.
Write stuff down. You know, that's some of that impulsivity, right?
We're
Just
getting
get
some,
pissed
we're
and-
getting to that point where he's frustrated with everything, and like, as soon as my husband does something, he'll take it back over, and you're just like, okay,
Yeah.
that's not gonna work. Yeah. Chuck
I'm
him
not
across
saying
the
this
room.
isn't challenging, this is very
Yeah,
challenging.
yeah.
But I think trying
Okay.
to think about, think of it to try to connect with them and to try, you know, imagine how they feel.
Oh, frustrated.
You know what I mean?
Frustrated.
That's what
Well, it's the people who taught you everything, and you're watching them can't not be able to do basic functions anymore. It's so
Total
hard.
role reversal, right? Yes.
My husband's had all those tests that you talked about except the SPECT one. And all they have found out in the brain scans is he's had strokes at the cerebellum. Could that cause vascular dementia? Okay, that's what.
Does he have balance issues?
Yes.
Yeah, that's the cerebellum.
And is there anything, I mean, I saw the diet and the exercise and anything more to do that
Is he sleeping?
he has, sleep apnea. No, he won't use the machine. Now, I have heard, I have a friend who has sleep apnea, and she has something that she puts in her mouth. I don't know, it's a guard or something. And I'm wondering if we ought to pursue that to see. His clock's off because he'll sleep all day and he's up most of the night.
So he's got reverse.
Yeah.
Night.
And he goes, okay, I'm gonna start going to bed earlier. He doesn't stick with.
Well, one of the tricks is to reset your circadian rhythm is to try to get outside within the first half hour of being awake. Get some of that sun on you. So if you can, hey, let's have our coffee outside today. Or trying to do that actually helps to reset your circadian rhythm. Because when they get that reversal, it gets really tough to get them out of that. Because they're sleeping all day, so then they're up all night, and you know, then you're trying to manage. And does he sleep at night at all, or?
No, I say it's good security because he's up and I'm sleeping and I get up and he's sleeping. So we have great security. But, I mean, at home, sometimes he does, but, I mean, he could sleep 20 hours a day.
Yeah, nothing twice over it.
It is kind of, I do my thing, you know.
Yeah, I mean, it could be vascular, but I would especially expect mobility issues with the cerebellum being an effect.
Yeah, he does have.
Yeah. Does he fall a lot, or?
No, but he's proud that he'll only use his cane in the house or his walker in the house and only the cane outside the house.
Because if he uses a walker, he'll look like an old person.
Exactly. Okay, then. I mean, he hasn't fallen lately, but yeah, he does. So.
Yes. Go ahead.
You had mentioned that there's more studies showing that alcohol is contributing to things. Has there been more recent studies showing alcohol contributing to Alzheimer's?
Not to Alzheimer's, but Wernicke's, also wet brain, some of the different types of dementias, absolutely. Yeah, Wernicke's is a big one. Yes.
So I've been on a dementia journey with my husband for many years, and when he first got the diagnosis, he was in denial, but I felt like he understood, and he chose to be in denial, and that was, his decision. Now I feel like he really doesn't know. And I just started reading about there is a new disease that starts with AGOR or AF or something, where truly
They
they're finding.
don't know, yes.
Okay.
Yes.
Okay.
Or
Yeah,
can't
it's
think
a
of the
big.
word, but yeah, it's about 10 letters long, it starts with an A, ends with an A. Yeah.
And is that with all dementia patients
Nope.
now, or just,
Nope.
okay,
Nope,
specific
so
stuff?
they truly do not realize that they have dementia.
Okay.
Which, that makes
It's
challenging.
positive and negative, right?
Exactly.
Correct.
Yeah.
And also, can you talk a little bit about with the nutrition? So, I know probiotics and prebiotics were a big thing, still are, for your gut health, and gut health allegedly controls a lot with your body.
Yeah.
Is there anything specific to research with the brain with that?
I think that the big, so what's good for your gut is good for your brain. What's good for your heart is good for your brain.
Okay.
Trying to stick as much with whole foods as possible. They're just putting so many fillers and so much garbage in anything that's in a box, or, a lot of stuff that's for convenience, but then you're getting ultra processed foods. So really trying to eat whole foods as much as possible.
Okay.
Even butter is okay.
Well, heck, don't eat lettuce.
Yeah, I know, I can eat lettuce.
Exactly. Yes, ma'am.
So, according to experience, you mentioned about power attorneys. I'm specifically interested in the financial power attorneys. Do you have any suggestions or to share? Because what's the risk of being a financial power attorney with somebody with Alzheimer or dementia? Because I have.
What's the risk of being a financial partner?
Yeah, or I don't know how to say that anymore. Anything you should need to be careful being somebody is a financial power attorney, I guess. Can be sometimes you have no choice.
Right.
But what if that person has debt or
I think there's more of a risk for somebody not having it and needing to make a financial decision for them, and you not being able to do that because you don't have financial power of attorney.
But the question I think is are you personally responsible
Liable.
Yeah.
for their
Making
debts, which would be
decisions.
no, because
Yeah.
they're the only ones, or their estate are the only ones that
Yeah.
are responsible for debts. You're just there to help
Right.
make payments or to make decisions on
I've got a client
Financial
right
things.
now that her wife has dementia. She's been in the hospital 6 times in the last month. And they keep sending her back home, and she's trying to get her placed, but she doesn't have financial power of attorney. So now she's meeting with an attorney I work with to get conservatorship and guardianship, which means they're gonna have to go to court and battle it out for her to get that so that she can have, authority over her finances and get her placed into somewhere where she's going to be safe.
So getting the power of attorney for finances and the power of attorney for
For
medical
medical.
prevents a lot of the having to go to court later.
Yes, yes.
So if you
But
get
also
them to
know that
sign
once they
letter.
pass away, those go out the window. Those are only while they're alive.
Right. So then you have to be the executor of their estates too.
Okay.
Like I have some clients that I act as their medical power of attorney, but I work with an attorney who will be their financial or their fiduciary, because I'm not touching anybody's money.
Right.
But I will help make medical decisions for them all day long. I'm comfortable to do
That
that.
answer your question.
But yeah, I'd say there's more of a risk of somebody not having it. I don't think there's a legal,
But you don't take over their,
Implication.
like, you're not responsible for their bills,
No.
for
No.
example.
or their debt.
No.
Right, when somebody dies, I know this from experience, you are not responsible for their credit card bills, because
Right.
one of the things that goes away that they can't come after you for if there's nothing in the estate is they cannot, their credit card debt technically goes away.
Right.
Well,
Ties with
that, if you're the
Yeah.
executor of their.
Well, that's different.
That's different though, yes.
Yeah,
Yeah,
well,
power
yes.
of attorney,
You will be,
that's.
yes.
Right. If
Right.
you're the executor, you're
still not
responsible for paying.
to pay the credits out of your pocket.
No.
Right.
Only
No,
the
right.
estate and the person
Right.
themselves are
Right.
responsible for it.
Yes.
Yes.
You don't pay for that out of your pocket.
No.
I think that might be one.
That is, yes, that's
Yeah.
correct.
Yep. Anyone else? I do have cards back there. If you guys have any questions, you could certainly reach out to me. But thank you for your time, and I hope this helps answer some questions.
Thank you, Kate.
Yeah. Something we need to hear, but also like to hear. But you don't know what you don't know with this stuff anyway, so thanks for joining us and getting grab one of these. So next month we'll be on Medicare. We'd love to see you back, probably some more information about Medicare.
If you would like to be on the mailing list, you can leave your name and email address or cell phone number, whichever you prefer, so.
As far as what, and that's him.
Feel free to grab any of the stuff on the table over here too.
You have my number.
Nice to meet you. I will. It was nice to meet you. It was nice to meet you. So, take care. Hold on, lock that phone.
Yeah, oh.
Yes.
You're talking about something.